Hi everyone, welcome to week 6 of your Medical Language 2 class. This week we're going to be covering chapter 24. Chapter 24 is called Pharmacy Laboratory Procedures. So basically what we're talking about here is compounding procedures. So when you go through this particular slide deck, you're going to notice that everything is really just lists of different types of terminology and what they all mean. So what I'm going to do is kind of point out some of the highlights to you as we go through this. Really one of the things that you need to understand about compounding, it's not that compounding is done a lot, but when you do compounding, it's very important that you do it correctly. There's a lot of different reasons that we do compounding nowadays. You may have heard of some of the problems with some of the actual manufacturers that are pharmacy compounders, and they've been having problems with sterile conditions or actually not having sterile conditions and producing product that had different types of debris in it and things like that. So a lot of pharmacies are turning to doing their own compounding, but there's a lot of regulations around them as well. Some of the reasons, again, we're going to do that might be just to make sure that we get the patient the right strength that they need. Maybe what we've got available in the pharmacy isn't the strength that the pharmacy or that the doctor ordered for that particular patient. Maybe we don't have that particular drug in stock, but we can make something similar to it. We've got a lot of special patient populations. Consider pediatric patients. They are really a special population all in and of themselves. So a lot of times we have to make things that aren't necessarily available in a pediatric strength. And then of course we have home health care and hospice environments that also are part of our compounding group. So some of the things that you're going to be looking at is the equipment. You have to make sure that you're using the right type of equipment when you are compounding. So you need to make sure that you're very familiar with that. One of the other terms that you're going to want to make sure that you really understand is something called aseptic technique. Aseptic technique is what we use to make sure that we minimize any type of contamination. So that is everything from hand washing to wearing gloves to using the right kind of tools. All of those things are part of aseptic technique. Another important topic here is the auxiliary labels. Whenever we're doing a compound, we're going to have to label it in a special manner so that the pharmacist can check it and so that the patient, doctor, nurse, whoever in the chain of command knows what's in the particular product that we prepared. There's a lot of other things in here. We've got beaker tongs, beakers, blenders, brushes, capsule filling equipment. So we've actually got equipment that we can use to fill capsules. Sometimes we do make capsules. Not a lot, but it does happen. The carts are actually used to transport the medication. The balance is something that we use when we're weighing solids. So a Class A balance is used for weighing solids. The clean room is an actual area that it has everything regulated. So air quality, temperature, humidity, everything. Even has special filters in it, all that kind of stuff. And there's a whole entire topic around clean room and what's required for the clean room that's out there nowadays. And I will put a link for that for you in this week's discussions so that you can look at that and understand a little bit more about those clean room procedures. Cocoa butter is just a solid product that's used as a base for many compounds. Counterbalances are used typically for larger quantities. We've got droppers, we've got drying ovens, we've got ethyl alcohol, a couple other topics. The filters again though that terminology is used for a lot of different things. It can be a small filter that's used when we're actually making something, or it can be the filter used in our actual clean room system. When we talk about extemporaneous compounding, that's just referring to the preparing and mixing and all of that. Gloves are, of course, something that we use to protect against contaminants. So there's, like I said, this entire chapter is all about the terminology. So it's all about learning about compounding. So as you go through this, if there's anything at all that you have questions about, please make sure you reach out to me. You can call, email, or text anytime, and have a great week.